My name is Stephen Doyle. I'm the primary healthcare nurse in Merchants Quay project for Merchants Quay Ireland in Dublin 8. I manage a clinic, a primary healthcare service for IVDUs, intravenous drug users and homeless people, foreign nationals. So the job entails managing a clinic. Apart from all the admin stuff, patient care is really important to us here, making sure that the clients are safe at all times. I could have an overdose over in the drop-in area, or I could outside in the someone could just walk in off the street like in an overdose sort of situation. I could deal with a toothache, pregnancy, people who are like floridly psychotic, a lot of wound care, wound management, chronic diseases, discharge summaries which we have to go through with patients who have been discharged from hospitals, and then we have to sort of follow on their care. It's kind of like a bit like a public health nurse service as well. We have to link in with the public health nurses as well, and then also try and find their accommodation. So Naloxone comes in this pink and white box. It's 400 micrograms in a ml, and it's for injection. You can give it IV or IM, and we only give it as an IM injection. And basically, so what a nurse would do, they would check the naloxone, and they would also check the date. This one is the 4th, 2015. And then there's a little blue thing here. You snap it off and draw it up in your syringe and needle. Then you would have an alcohol swab. You swab a person's arm, and then, you know, with the syringe on, you would inject, pull back, and slowly inject it into the muscle, and it, you know, it takes effect to the patient quite quickly. It has saved a lot of lives, I can say that. Like last week, I had an overdose just across the street in the park over there at Dublin City Council, and one of the security guards from Dublin City Council came running over to us asking us for help. There was a man in the park. He was actually blue, and we had to administer CPR and give naloxone, give the oxygen and naloxone straight away. And he ended up not going in the ambulance, which is quite sad, because a lot of them don't go in the ambulance. Then again, others do. But this man, I had worked on him for about, I'd say about 10 minutes. The ambulance came, naloxone was given. His saturation, I know, was like, the stats were down to like 85, and his rests were like lower than 6, lower than 5, 6. So, and he was blue, completely blue. So it was quite nasty.